Okay, so this patient is a 19-year-old right-hand dominant student athlete, baseball player. Preoperative diagnosis on his imaging, on his MRI scan, was that he had a slap lesion, specifically a type 2 slap lesion. And as we pull on the long head of the biceps tendon here, we can see where this is a bit loose. What makes the diagnosis, in addition to this finding, is the fact that he's been symptomatic for more than 6 months and hasn't gotten better with rehab. And all of his in-office testing suggests that this is the source of his dysfunction. But you can see how the bend in that probe is 1 to 2 millimeters, so you can see we're talking about something that's very, very small in size. The other issue is that to get this to heal, you've got to remove the cartilage. You can see that this pulls away and it won't heal back just to cartilage. You've got to remove this here down low to get this to heal back. Okay? And you can see how it extends around here. Now, interestingly enough, he's also got some partial tearing in his rotator cuff tendon. This is the undersurface of the supraspinatus tendon, and we can see some fraying here that was not well appreciated on MR. But as I put the probe into it, we can see how the probe starts to disappear here. Okay, so we may very well have to do something here as well in terms of repairing the rotator cuff, whether it's a partial tear or has a full thickness component. I think it's just going to be a partial tear. As we look down at the anterior labrum and identify the middle glenohumeral ligament, this is the leading edge of the subscapularis tendon. Right here, this is subscapularis tendon. Nice big strong tendon. We can only see the superior 1/3 or so of the subscap. Crossing the subscap is the middle glenohumeral ligament, and essentially this is it. This little wispy thing here is what's left of the middle glenohumeral ligament. He doesn't have a very robust one. This is the labrum, so the cartilage stops here, the labrum stops here. So the labrum is only 2 or maybe 3 millimeters wide. You can see that, and it's not very thick. You can see how flimsy it is. That's the labrum, okay? The inferior glenohumeral ligament is this band right here, and he's got a pretty well-defined IGL. This is the anterior band of the inferior glenohumeral ligament. He had no instability when we examined him under anesthesia, so we're not going to do any type of capsular plication because our best instability exam under anesthesia showed that he had no significant instability. Okay? So there's the anterior band of the IGL. It's just this fold at the tip of this probe running in this direction. That's the IGL. The posterior band of the IGL is usually back here. He doesn't have a well-defined one, but that's relatively normal. And you can see the posterior labrum is really just a rounded off structure here starting to the right of the probe. That's the posterior labrum. It's really a very, very small structure to target, even under direct visualization under 30 times magnification. So putting this all together, I think we do have some laxity here. It's going to require a 1.8 millimeter Y-knot suture anchor. And then we've got some tearing here in the rotator cuff. So we'll clean up these areas and make a bit more of an assessment in just a minute. Okay, so now we've got a second cannula coming in. This part of the shoulder is called the rotator interval. Take this away. And when we put our probe in down here, this is the cannula that's going to give us a good angle to debride the cartilage. Let me see the shaver. So this shaver is a 4 millimeters diameter shaver. From side to side, that's 4 millimeters. So again, very small. Hold this, please. We'll rotate and look down. 6 o'clock here. And you can see how the shaver just slides right in front. If it doesn't do that, then we really don't think it's a pathologic injury. But this shaver slides right down here. And what we're doing now is removing the cartilage that rides over the superior edge of the glenoid. This is not the cartilage involved in the glenohumeral articulation so much. This is over the edge. You can see this is not part of what we call the weight-bearing aspect. As we remove the cartilage, we're going to get down to the bone. Almost there. Pause, please. Can we see the rack, the black? Okay, so here's what we're trying to do. You can see the bone there, how we remove the cartilage. The cartilage is white. The bone's kind of not white, or more yellow or orange. And so we just need to expose that so we have a good healing surface. And that's what we've been working very carefully to do here. We've still got our other cannula in. So now we're going to go ahead and get to work placing the suture anchor in, now that we have things prepared. Okay, so we've placed our anchor down, and this particular anchor has two separate sutures. You can see there's a black and white and a blue and white suture. And as we pull on it, it's very tight. As I hold the camera still, you can see I can move your whole shoulder just pulling on those two sutures. Now we're going to reach in and take a crochet hook and take 3 of the sutures out of the way. So we'll reach in here. Take these 3 sutures through this cannula here. Switching stick, please. Hold that. I need the regular size. You're not going to use that one today. Hold the camera, please. Got it? So now we back the cannula out to remove the sutures from the cannula. Then we push the cannula back in. Okay. And so now the next step is to take the one suture that we're going to work with first and bring this inside the cannula, just like that. So now we're ready to go. Okay, so we're going to go ahead and get ready to pass the suture here. Here's our suture hook. It's loaded with a black wire that we call a super shuttle there. There's some holes in that allow us to pass the suture. We're going to start over here behind, rotate down a little bit. No. We're going to start behind the biceps right about here. Slowly work our way through. You can see the needle tip coming out just underneath. We'll feed that relay through. And then we'll retrieve it outside this other cannula. Just like that, pause. Okay, so now as we pull back on the super shuttle, if you look carefully, you'll see how it brings that blue and white suture right there. It brings it underneath. And then once you pull it all the way tight, you can look here and see how it comes out behind right there. That's how we do that. And so now the next step, pull that down. The next step is to go ahead and reach in and get the partner blue and white suture here. So we'll lift up on all these. And the one we want is this one right here. Okay? Pause. See, as we tie this knot, it's going to slide down into position back here. just a minute, we'll lock it down. Like that. Pause. Okay, so we've tied the first knot. It's secure. I'm using this crochet hook as a probe. And you can see how the area where it was loose right here, we've got a suture around that now. This is part of the torn rotator cuff right there. We'll get that sorted out in a little bit. But now we've got the second suture inside the cannula. We're ready to pass a second stitch, basically coming right through here. We've got two sutures passed and tied. You can see the cut edges. And what we've been trying to do is stabilize this bicep so it doesn't pull off. So now as we tug on that, that's not going anywhere. See how that's stable at the bottom? So that 4 millimeter gap is no more. So hopefully that'll heal up. Now we've got to sort out what we're going to do with this rotator cuff. So we're going to put a shaver in here and get ready to debride some of this torn tissue. Pause. Shaver coming in. We obviously don't want to remove any good part of the cuff. I think that's the extent of it, basically. So what we're going to do is place a stitch that will serve as a side-to-side repair stitch and also as a marker stitch. We'll take a spinal needle. Bringing that needle right through, kind of on the posterior edge of the tear. That's not bad. Okay, so here's the first pass with our needle. We're actually on the anterior edge of the torn area. We're going to go ahead and pass a shuttle relay. Take a grasper. Put that in the anterior cannula. You can see how just a spinal needle, how big a spinal needle is compared to the labrum. See that needle? So your margin of error is really a couple degrees at best, okay? Because that, what you see there is just an 18 gauge spinal needle. Now we'll take our suture. That gives us the first part. We're going to take the spinal needle one more time and pass it on the back side of the tear. Needle coming just on the posterior edge of the tear. Hold that. We're going to pass that relay one more time, which means we'll need the grasper one more time. back slowly. You can see how it brings the other end of that stitch and gives us this ripstop stitch to prevent any further tearing and hopefully assist in the healing process if this is all we have to do. We won't know that until we go on the bursal side to see if there's any bursal tearing. Okay? So we will stop here inside the joint and get to work up above in just a minute. Okay, so this is our first look in the subacromial space. And it's checking out pretty good. Now, at the top of the screen, that's the coracoacromial ligament right here. And as we look at it, it looks pretty good. I don't see that there's been any kind of ongoing irritation to it. So that's encouraging. There's one of our sutures for the rotator cuff, so we're going to be looking at that in a minute. I don't think we're going to have to do a decompression based on what we're seeing here. So what we're going to do next is we're going to go ahead and put the camera right where that clear cannula is. We're going to switch positions here. Here's what we're doing. We're looking from the lateral side of the shoulder. This is posterior. You can see our two sutures. And the good news is the bursal side of the supraspinatus is pristine. It's not torn. Remember how we passed those on the articular side. So we're going to tie those in a minute just to function as a ripstop stitch. And then as we look towards the front, we can confirm a couple things. One is that the coracoacromial ligament at the top of the screen above that cannula looks good, so I am not going to do a decompression. And that the anterior cuff looks great. So as I'm rotating your shoulder as we do this just to get a complete look at the supraspinatus and infraspinatus tendons. Infraspinatus is more back here. And as we look around the edge, we can confirm that that rotator cuff is intact. Okay? There's a good view of it as we rotate. So we're going to go ahead and tie these sutures. We'll show you when we're done, and then we're going to get you back to recovery. So there we are. We've cut the suture. You can see how we didn't want to tie it too tight, but now that's snugged down. And we're going to finish up here and get you back to the recovery room shortly. So hopefully this will get you back doing everything you want to do. Good luck to you now. Bye-bye.